Hi, I'm Dr. Valerie Nelson, naturopathic doctor from Pittsburgh, Pennsylvania, actually Bridgeville, PA, a little suburb outside of Pittsburgh. And I was just going to take a moment to go through our product line. We've been using many of the products for 10 years. They've been used on about 2,000 people at this point, and I've helped a lot of people, been privileged to be able to do that. So I'm just going to go through one at a time and tell you a little bit about them. We have two multiple vitamins that are whole food multiple vitamins. One is called Lively Multi, and the other one is called Whole Food Energy Multi. You do have to be careful buying multivitamins from the grocery store, as a lot of them will contain propylene glycol or artificial dyes. The Whole Food Energy Multi is a little bit larger in size. It has a few more nutrients in it than the Lively Multi but some people prefer a smaller size tablet, and so our Lively Multi by all means is our most popular multiple vitamin, and the Whole Food multiple vitamin is the other one. Okay, I'm going to move those off to the side whenever I review them. Next I'm going to go with our Uplift. We have two products that are really popular for anxiety and depression or any kind of stress related illnesses. Whether that be high blood pressure, a lot of people do not want to be on SSRI medications and because of the toxic side effects from them, but they want to have a natural choice to take. You can take these even if you are still on an SSRI medication, and there's no harm in doing that. So some people will start on these because they don't ever want to be on those medications. Some people will start on those as a way to start to address the underlying issues of why they had to have depression, had to be on depression or anxiety medications to begin with. Uplift is the tablet form, and the most common dose would be 2 twice a day. Now, if your depression, your anxiety is pretty severe, I mean, we've had some people be on as many as 8 to 10 a day. Again, if you came into my office for an appointment, we would muscle test you by touching an acupuncture point and seeing what your dosing amount would be for each one of those. So the Uplift is, again, the tablet form. And you want to take that with food, and your urine will turn yellow if you take either one of these products. So a lot of people think if your urine's yellow, that means you're urinating out your vitamins and you're taking more vitamins that you need. That's actually not true. You do want your urine to turn yellow whenever you take these two products. So we always tell people that. Again, these should be taken with food. All natural vitamins, minerals, and herbs. The stress calming factors, used to be called calming factors, it's now called stress calming factors, is actually our capsule version for people that have trouble swallowing tablets, and it has a much more pleasant smell than this one. We've added some herbs and some essential oil type things like lavender and lemon oil, which is or lemon balm, which is actually really good for calming down stressors. And again, the dosing of this will be like 2 to 3 2 times a day in a split dose, usually the first meal of the day and the second meal of the day. So again, these are by far our most popular products, and you don't have to have a diagnosis of depression or anxiety to be on these products. You know, this is just for like people that are juggling a lot of balls. I'm a person who actually juggles a lot of balls, obviously being a business owner. So I take these every day. And it also helps with mood swings. If you have anybody in your family who has fluctuating like mood swings where their moods are all over the place, people that have concentration problems, people that are just edgy at the drop of the hat, it can make such a huge difference to have for people to take these. Okay, so going right on along, I'm going to talk about our Candida fungus fighters. We have a few different products to help reduce yeast, Candida, fungus in your system. Candida Fungus Fighters is one of our most popular ones. It used to be called Fungus Fighters. We actually have another one called Buggers Be Gone. I realize I don't have that bottle right here, but there's a lot of people that have yeast, candida, and fungus issues, and they can cause all different kinds of symptoms. Oh, there's the Buggers Be Gone. Thank you. Okay, so the Buggers Be Gone. So these two formulations are a little bit different, but when it comes to yeast, candida, or fungus, or parasites, you do have to trick them sometimes, and a lot of times they need to be treated a lot longer than you would realize. As far as dosing goes for the Candida Fungus Fighters and the Buggers Be Gone, actually, you want to start with 1 a day, and you want to increase it by 1 each day up to 6. So, for instance, day number 1, you'll take 1, and day number 2, you will take 2, day number 3, 3, and so forth. Up to 6 if you can, and you want to split the dose. So when you're on 2, you want to do 1 in the morning, or lunch, and then 1 at dinner. You just want to split the dose. You increase it to bowel tolerance. So if you reach 3 and you're just moving your bowels way more than it's comfortable for you, then you just want to stay at 3. But if you can go ahead and bump it all the way up to 6, it's very natural whenever you start taking a supplement like this to actually move your bowels more, and that's usually what we want. But those are how you take those two things. And if you're not sure which one to take, this is by far our most popular. Sometimes you have to switch it up though. If a person's coming in here for an appointment, we always muscle test to see which one they're strongest on, because we do have something called Fungus Cleanse as well. Fungus Cleanse is a homeopathy, and it does the same thing. It is actually for cleaning out candida, fungus, or parasites in the system. And homeopathy is really, really simple to use, and it hardly has any taste. We use homeopathy a lot in our office. So if you choose to have something that doesn't have a taste at all, this is always a really good and gentle place to start. With the Fungus Cleanse 1 and the Fungus Cleanse 2, what you want to do is you'll do 10 sprays underneath the tongue, and you hold it in your mouth for 10 seconds, swish it around, and swallow. You do that 3 times a day, and then the next day you go to Fungus Cleanse number 2. So Fungus Cleanse number 1, then Fungus Cleanse number 2. We just tell people either put them in your cupboard, and whatever day you're on, switch it, put the other one behind the other one so you remember which one you're on. Whenever you do any kind of homeopathy from our office, you always want to tap the homeopathy either against your side, against a palm, against a hard surface. That is called succussion. It's been done forever, and homeopathy has been used since the 1700s. And what it does in essence is it increases the energetic component in the formulation. It's similar to whenever you were a kid and you'd rub your feet against the carpeting and shock your brother or sister. Not that I would ever do anything like that, but and it increases the energetic frequency in the homeopathy. So anytime you get a liquid homeopathy, you always want to tap it a few times against your palm, spray 10 sprays under your tongue, hold for 10 seconds, and then swallow. So the ones that we have for intestinal cleanses are, again, the Candida Fungus Fighters, the Buggers Be Gone, and the Fungus Cleanse number 1 and number 2. We also have a digestion pack. There's a lot of people that have IBS out there. So if somebody is not coming in to see me for an appointment, which again, that's completely fine to take our supplements without coming in for an appointment. Anyone's welcome to use them, with the exception of 2, and we'll go over that in a minute. But if somebody has significant digestive problems, we will recommend something called the digestion pack, which consists of the Candida Fungus Fighters, our professional probiotic, and the intestinal enhancer. So these 3 products are a lot of our people are on these three, and they have made a world of difference for digestive issues. Okay, we already talked about the Candida fungus fighter, so I'm going to go into the intestinal enhancer, what that does, and why that's a good addition to the Candida fungus fighters, or the Buggers Be Gone. The intestinal enhancer is our complex digestive enzyme product. It consists of 18 different digestive enzymes. It's been just a remarkable product for a lot of people. The reason it works good for Candida or fungus or parasite issues or anyone with digestive issues is some people just cannot break down the foods. For one, we're not chewing our foods as often as many times as we should. You have salivary glands right underneath of here that'll squirt out all types of enzymes for digestion, and so it's really, really important to chew until your food becomes liquid. It's a hard habit to break, but it's a free thing that you can do that'll really help the whole process. But intestinal enhancer helps to digest food more quickly, and it solves a lot of issues for many, many people. Some of the ingredients in intestinal enhancer will also break down cell walls of destructive bacteria, and actually even cancer cells. There's a certain protein buildup around bacteria and viruses that we don't want, and actually the intestinal enhancer will break those down without doing damage to your other cells. So the most common dosing amount for this would be 2 right before each meal. They will work with a meal, in between meals, but if you want the most ideal time, it would be 2 before you eat. But they will work either with food or in between meals as well. Okay, so the professional probiotic. I am really, really super picky about the probiotics that people take. Matter of fact, I paid a manufacturer $12,000 up front to develop the probiotic that I wanted. So the professional probiotic, it's actually a very good value. There's 100 capsules in here. The most common dose would be 2 on an empty stomach. I would wait about 20 minutes before eating. So if you get up in the morning, take them as soon as you get up. You should refrigerate them after you open them to keep them fresh. I forgot to mention earlier that our products, almost all of our products, if you buy 3 of the same product, so for instance, if you bought 3 stress calming factors, you get $10 off a 3-pack bundle. So a lot of individuals will do that. It saves them a lot of money. So, or any of our products, most of our products, some of them are $5 off a 3-pack, but almost all of them are $10 off a 3-pack. Okay, vitamin D3, I cannot say enough about vitamin D3. It's inexpensive. It gives you so much cancer protection. It's good for your brain. It's good for hormone balancing. It's good for your bones, and so forth. So anytime you get blood work done, you absolutely want to get your D3 levels checked. Now, I'm going to spend a little time talking about the lab work, because the lab work will say that normal levels on the lab results would be between 30 and 100. But honestly, if you're down 30, 40, 50, that's really not where you want to be. You want to be between 70 and 100 on the blood work. So if you've never had your blood levels tested, by all means, next time you get blood work done, have your levels tested. And if you don't know, we will say 5,000 IUs per day. It's very common when we work with individuals with thyroid disorders to have low vitamin D3 levels, and a lot of times low iron levels too. But anyways, the amount that you want to take, if you don't know what your levels are 5,000 a day, and that's even if you get plenty of sunshine. For instance, I take 5,000 IUs every day. I get out in the sun whenever I can. I do my work outside when I can. And when I had my levels tested last year, I was in the 60s. So now 2 days a week, I take an extra. I take 10,000 IUs 2 days a week to get my levels closer up to the 70s, 80s, 90s. So Again, a lot of bang for your buck with the vitamin D3. Pain Away. Pain Away is very popular. It's a great complement with the Arnica 1M homeopathy. Pain Away is an all-natural, plant-based anti-inflammatory. I wish I could call this anti-inflammatory because some people have inflammatory responses, but not really any pain. The FDA just won't let us put that on the bottle. It's against their regulations. So Pain Away is our all-natural anti-inflammatory. And the most common dose is about 2 to 4 per day, but it's not going to hurt you if you need to take up to 6 a day. But many pain issues have been resolved with this. Arnica 1M is actually our homeopathy. It works a little different than the Pain Away. Again, the homeopathies, just as a reminder, you tap them against your hand a few times, spray them right directly under your tongue, swish around in your mouth, and then swallow because they'll absorb quickly in the mouth membranes. Arnica has been used since the 1700s. It's for any kind of repair that needs to be done in the body. It's one of those things I carry with me all the time. It's always in my car. I always know right where it is in the cupboard. Matter of fact, a few months ago I went up and I was energetically jumping up on a stool in my kitchen, and I hit my knee off of the counter part, the decorative counter part underneath, and it really hurt. So the first thing I did is I went to the cupboard, I sprayed the Arnica in my mouth, and really by the next day I was amazed. I didn't have any residual, any kind of side effects from jumping into that, hitting my knee off that decorative bar thing. This works better as soon as the injury happens. So it's one of those things I carry in the car trunk as well. Trying to think what else I could tell you about Arnica. Oh, if you know you're going to be in a situation pre-surgery, before your kids get the braces adjusted, if you know you're going to be in a situation where there's going to be pain involved ahead of time, by all means start taking it before that for a day or two. It also stimulates repair, so you'll repair a lot faster after any kind of surgery. Immune support. Okay, we have immune support. Again, there's FDA regulations.